Welcome to St. Therese. We're glad you've chosen us to help with your needs. The purpose of this short presentation is to orient you to what occupational therapy is, how it can help your friend or family member, and what you might expect during their course of occupational therapy, or OT, at St. Therese. To begin, we'll start with some background. Occupational therapists have a master's degree, and occupational therapy assistants have an associate's degree. Both levels of therapists are licensed to practice by the State of Minnesota Department of Health and must renew their license on an annual basis through meeting practice and continuing education requirements. The occupational therapy plan of treatment is ordered and approved through the physician. In a transitional care unit site, this may be the house physician and not necessarily the person's routine family physician. So what is occupational therapy? Occupation refers to everything that people do during the course of everyday life. Occupational therapy helps individuals when their ability to do everyday tasks is interrupted due to illness, a surgery, a fall, or other issues. Everyday tasks that could be affected include things like getting dressed, cooking, attending to needs in the bathroom like using the toilet and the shower, shopping, cleaning, driving, getting around the room, and managing medications. In order to regain or improve the ability to do everyday tasks, occupational therapists may work on many component skills or skills that are needed in order to successfully complete a task. For instance, strength to reach, stand, and lift objects, balance to be able to safely reach into the refrigerator, endurance or stamina to be able to make breakfast without becoming exhausted, thinking skills to be able to remember and figure steps out in order to make a meal, coordination of the arms and hands to be able to pick up objects and use them. Improvement can occur in many skill areas during occupational therapy. Sometimes, however, there is a limit to what skills the person regains due to the nature of their condition. When things like balance, thinking skills, or vision remain limited, the focus of occupational therapy moves from trying to improve the skills to making adaptations or changes to compensate for the loss of those skills. The occupational therapist, with the patient and family input, may adapt the task, for example, using a chair in the shower to improve safety when the person's balance is not good. They may adapt the environment, for example, recommending a grab rail or marking a stove dial that cannot be easily read. They may recommend adaptive equipment, for example, a reacher to pick things up, a walker basket for carrying things, or a magnifying glass. They may educate the caregivers about ways to decrease the risk of falls, or provide information about the person's thinking skills and how they may impact their ability to be safe at home. Finally, the occupational therapist might recommend services or alternative living situations, for example, Meals on Wheels, a bath aid, an adult day service program, or possible home care, assisted living, memory care, or a long-term care facility. Each department has a special focus for patients staying in the transitional care unit. For instance, the nursing department focuses on things like medications and vital signs. The physical therapy department has a special focus on walking. In occupational therapy, the focus is on the ability of the person to do everyday tasks, with a special emphasis on the thinking abilities required for those everyday tasks. Thinking abilities include memory, knowing the next steps, and being aware of potential safety issues during tasks. So why is it important to focus on thinking abilities? Although the loss of memory is not a normal part of aging, as we age, we are more likely to have memory difficulties. In fact, after age 85, the risk reaches nearly 50%. This can make older adults vulnerable in many ways. They may have many medical diagnoses and may be physically frail. Knowing about any memory issues that are present can help the care team look at the patient's full situation to help with knowing the patient's strengths and challenges and how to meet them so that the person is safe. Physicians and the interdisciplinary team work with the occupational therapy department to understand the thinking abilities of the person, which can help guide the care center team in decisions regarding discharge planning. When there is difficulty with thinking skills and doing everyday tasks, occupational therapists can work with the patient and/or their caregivers to develop adaptations or strategies that can help aid memory, communication, and completion of everyday tasks. Occupational therapists can also help families understand more about memory loss and ways to meet these challenges. The Occupational Therapy Department assesses thinking skills through a combination of formal and informal methods. The formal method includes giving OT tests that were researched and developed specifically for evaluating a person's thinking skills for everyday living. The primary test used is called the Cognitive Performance Test, or CPT. We'll tell you more about this test in just a minute. The informal method includes gathering information from the patient and their family about how the person has been functioning at home. It also includes observing the person while doing actual activities that they may be likely to do at home. This will include looking at how the person learns new things, responds when the unexpected happens, recognizes and fixes errors when they arise, and their overall safety awareness. The CPT was developed to determine how a person is functioning now. It can also be given over time to detect any changes that might be occurring in the person's thinking abilities. There is extensive research to support the use of the CPT. The CPT looks at how a person thinks through and performs common daily tasks. Depending on how the person performs, the test can predict how much help the person might need with daily tasks, including the type of help and how often it is needed. Last, the CPT can help figure out what the strong points are for the person, which can be then used to create strategies to help compensate for a loss in thinking skills. For example, the person who has trouble following spoken directions might be able to follow written directions and might benefit from the use of reminder notes. So how does the CPT measure how a person thinks through a task? Well, all daily tasks have multiple steps. And in order to do a task successfully, the person needs to take what they have at hand and figure out how to proceed. They need to know what to do first, second, and third, even in a different environment than they are used to performing in. They need to be able to recognize if something goes wrong and then know how to fix it. They need to make good decisions throughout the process. If a person has difficulties with any of these steps, he or she might need more help to be successful. This could be something as simple as a verbal reminder, a written note, or an item handed to the person. There are 6 tasks that are presented, each with very specific items and instructions that the OT must use and follow exactly. Whenever the person needs more help or a different setup to do the assigned task, their score is lowered. Each task receives a score. Then the 6 scores are averaged together to give a final CPT score. The goal of the test is not just to determine if the person can complete each task, but rather the goal is for the OT to determine what the general pattern of ability is throughout all of the 6 tasks. The OT is looking for things such as if they can do the task without help, or do they need some sort of setup first? Do they need some verbal cues or more visual cues? Do they need the task simplified so that they only have 1 or 2 steps to complete? Note that if the person no longer does 1 or more of the CPT tasks, they are still included in the test. This is because research has shown that even tasks no longer routinely performed remain a fair assessment of thinking abilities. So the CPT score can give us information about how much help a person is currently needing to figure out and complete tasks. It also gives guidelines about what level of assistance the person might need in order to function at their best and be safe. This guide is a reference to what the score means. You'll receive reference guides such as this to help with explaining the meaning of the CPT score. CPT scores can be influenced by medication side effects, refusals to participate, or if the person is not taking the testing situation seriously, and other difficulties like hearing or vision loss. The occupational therapist will note if these are factors in the testing. A CPT can be retested during a stay in the transitional care unit if needed. The typical course of occupational therapy at St. Therese starts with an initial occupational therapy evaluation to see how the person is currently doing. This includes asking the patient about a typical day for them at home and what they need to be able to do when they leave St. Therese. Together, the patient and therapist develop a therapy plan and set goals. The OT will communicate with the patient's primary contact to tell them about the plan and to gather any additional information, including if there are any concerns from the family. Treatments to address the goal areas will be completed, and in most cases will include a cognitive performance test to assess the person's thinking skills. An occupational therapy update, including the person's physical abilities as well as their thinking skills, will be provided to the primary contact through a phone call, during a visit to the therapy clinic if desired, and/or at a care conference. For some transitional care unit patients, a visit will be scheduled by our home visit occupational therapist. Follow-up communication or training with the caregivers will occur as needed. The occupational therapist will also use this information to help families and caregivers understand how much help a person might need to return home or to a new place such as assisted living. The patient is our number one priority at St. Therese Rehab, and we extend this to the family and caregivers as well. We invite you to think of us all as partners, and we welcome your questions and feedback or comments you have. If you feel you do not understand something or are wondering how the person is doing, please ask, or better yet, come into an occupational therapy session with your friend or family member. Together, we can help patients achieve their maximum potential while staying safe in their environment. To contact any of the OTs in the department, please call. OT sessions are generally held between the hours of 6:30 a.m. until 3:30 p.m., and times and days do vary. You can learn more about St. Therese at our website, www.sttheresemn.org. Thank you for your time and interest in learning about the Occupational Therapy Department at St. Therese.